Hello, I'm Dr. Karen Young, a proud alumni and the Neonatology Fellowship Program Director at the University of Miami Miller School of Medicine, Jackson Memorial Hospital. We're thrilled that you've chosen to explore our fellowship and hope you'll get a good idea of why we're so proud of our program. One of the questions that I'm often asked is, why did I choose to train at UMGMH and why did I remain as a member of faculty? And I often answer, if you're looking forward to training in a busy program that will expose you to diverse patients with complex problems, this is the program for you. If you want to learn cutting-edge research in our standalone Children's Research Institute or our state-of-the-art pulmonary physiology labs, this is the program for you. If you want to be an effective educator, inspiring the next generation of learners, this is the program for you. If you want to train in a program that recognizes and cultivates your unique talents, this is the program for you. So why did I remain as faculty? This program provided the mentorship for me, a young resident who had never done research prior to fellowship, to develop groundbreaking stem cell therapies. This program allowed me to obtain a master's in clinical and translational science, and importantly, this program has become my family. I hope the next few minutes in this video will begin to acquaint you with all we have to offer and more. And I look forward to having you with us as a member of our family in 2023.
We're so sorry you can't come in person to our NICU, but we hope this video gives you a real glimpse of our unit. Speaking of which, little is not the word one would use to describe the Jackson Memorial NICU. This is a true level 4 NICU with 126 bed capacity, making it, as we said before, one of the largest in the country. It is the main NICU for Miami and serves as a regional and international transportation hub for complex maternal and neonatal cases. In addition, we offer all pediatric subspecialties on site. We oversee the perioperative care of cardiac patients. We perform ECMO, and most surgeries are performed right here in our unit. At the end of our fellowship, you would have had extensive exposure to virtually all neonatal pathologies. Yep, it keeps going on and on. I should add that as overwhelming as it may seem, it is really well organized and patient care is divided safely and appropriately. You're responsible for a reasonable number of patients as a fellow at any given time.
Hello, I am Dr. Eduardo Bancalari. I am the director of the Division of Neonatology at the University of Miami Jackson Memorial Medical Center. Our training program is almost 50 years old, and over this long period of time, we have trained almost 150 trainees who have become either clinical neonatologists or academic neonatologists that are practicing throughout the USA, and many of them also in other countries around the world. The main characteristic of our training program is its balance between clinical and research activities. Clinical training is obtained in our neonatal intensive care unit, a very large and busy service that gives the opportunity to trainees to become comfortable in the management of the sickest neonates. The research activities available to trainees include clinical research or translational research, both under the mentorship of our faculty, that includes senior faculty, mid-level faculty, or junior attendings who have joined our program more recently. We feel that this program, because of its experience and the quality of the faculty, offers a fantastic opportunity to obtain training in neonatal care. We are happy that you are interested in our training program, and we encourage you to visit our web, obtain all the necessary information, and we hope to see you as one of our future trainees in the coming year. Thank you.
A typical day on service starts at 7 a.m. when you arrive to get sign out. Dr. B arrives nearly every day around 7:30 to hear about events from the night and do some bedside teaching. Academic rounds occur between approximately 8 to 11 a.m. and include residents and medical students. The next few hours are spent completing any necessary patient care. There might be a lecture or a journal club, and you might be called for an inpatient consult. If you are not on the 24-hour call, the nighttime fellow arrives at 4 p.m. for evening sign out. We are typically able to leave the hospital between 4:30 and 5 and are very good at getting each other out on time so that we can get enough rest and enjoy everything Miami has to offer. Your clinical rotations occur at our two main facilities of Jackson Memorial Hospital and Jackson North Medical Center. We use a 13-block 4-week system where we start on a Monday and end on a Sunday. During your first year, you will complete 4 blocks in NICU A with the most sick patients, 2 blocks in NICU B with intermediate level patients, 2 blocks at Jackson North are level 2 community NICU, and the rest will be for research. The following years have significantly more time dedicated to research. During your first year, you will complete approximately 60 calls, which is roughly Q4 to 5. The fellows make the schedule, and you are typically able to get the blocks and specific dates off that you want. We're also free to make any changes as long as it's done responsibly and is verified by the chief fellow. You get 4 weeks of vacation that you can take whenever you wish, with the exception of the last 2 weeks of June and the month of July.
Research is a very important part of our fellowship, and quite a bit of time is dedicated to it. If you know that you want to do research in your future career, it is important to look for programs that line up with your interests. Here in our program, there are ample opportunities for clinical and basic science research. We are home to one of the largest standalone pediatric research facilities in the world. We have a lab dedicated to neonatal basic science research, which produces cutting-edge research in areas such as lung injury, brain injury, and stem cell therapies.
Hi guys, my name is Muhammad. I'm one of the NICU fellow at Jackson Memorial Hospital. I live in Brickell, downtown Miami. And actually this part of Miami with a truly urban feel. You can look around, we have a lot of luxury high-rise buildings, tons of restaurants, and a lot of recreational places. And guess what? It's just 10 minutes away from the hospital and it's accessible by public transportation. And looking forward to seeing you soon.
Work-life balance for you in fellowship?
Very.
And do you think you're able to have that?
Yes.
Pelican.
I chose to come back to Jackson after doing my residency away because it has a lot of volume. We have really sick patients, and mostly because of all the people here, from the attendings to the nurses to my co-fellows. It's the people that make the place special. So for my research, I have been lucky enough to do both basic science and clinical research. And recently we've had some exciting news that both my co-fellow and I were awarded 2 Gerber Foundation research grants to do clinical microbiome research here in the unit. So we're very excited to start that. 100%.
And whether we end up ultimately as your top choice or not, we want to thank you again for applying, and we wish you all the best on your application journey. We put together this little checklist of things to think about and ask at each interview. First would be location, quality of life, and cost of living. You want to remember that this isn't just the job you're working, it's also the life you're living. Next would be medical. What's the size and acuity of the unit? A very important question to ask is, what won't I get to see during my time here as a fellow? What is staffing like? Do you have in-house NPs, in-house attendings? What's the level of fellow autonomy? You also want to think about the patient population. Is it culturally and ethnically diverse? Because it can add a lot of breadth to your training. And then what are the research opportunities? If you're really interested in research, you want to make sure that the fellowship program aligns with your personal interests. And then you want to look at the scheduling. What's your day-to-day workflow going to be like? What's the block structure? What's the call schedule? How many time off between calls? How much protected research time? And if you're worried about board preparation for the pediatric boards, you want to get a sense of what it is they're going to be able to do to clear up time and help you prepare in the first months of fellowship. And then most importantly, you got to pay attention to your gut feeling. I remember there were programs I assumed were going to be really high on my list, and when I actually went and interviewed there, I just didn't feel it. Remember, you deserve to be happy because you're going to be working really hard.
I chose Jackson because it's a family.
I chose Jackson because I want a career in academic neonatology, and they have a strong track record of research.
I chose Jackson because the fellows are happy here.
I chose Jackson because of the city and because of the patients.
I wanted to just end by highlighting some key things that set our program apart and that I hope you'll keep in mind as you're reaching your final decision. Miami has a level 4 NICU with over 120 beds, all pediatric specialty services and procedures, and an incredible breadth of clinical cases. It's the main teaching hospital for the University of Miami School of Medicine, a major regional and international referral center. It hosts one of the world's only standalone pediatric research institutes. It also hosts the world-renowned annual Miami Neonatology Conference, and you get to live in a vibrant, globally important, and surprisingly affordable city.